Hello everyone and welcome back to our channel Quaint. Today's topic of discussion is the encephalopathy of empathy, nurse burnout's brain signature. So there is one term you can see, encephalopathy. This is a broad medical term used to describe the changes in the brain structure or function due to stress, injury or disease. So this is encephalopathy. Next term is empathy. Empathy, this is one of the greatest strengths of nurses. And nurses actually are not just professionals with stethoscopes. They are human beings whose empathy is written into their very neurology. Yes, without their empathy, you cannot actually imagine a healthy healthcare system. So that's why they are called what? They are called heart of healthcare, or better to say healing heart of healthcare. Okay, anyway, so their empathy, means nurses' empathy, that actually helps patients feel understood, cared for and safe. But empathy is not just a feeling. Actually, there is a difference between sympathy and empathy. I think you know this thing. So empathy, this is not just a feeling, this is a brain-based process. And when the nurses absorb, better to say, when the nurses constantly absorb the pain, anxiety and suffering of the patients, in that case their brains engage in deep emotional resonance. Okay, and this can overload the neural circuits that actually regulate stress, emotions and decision makings. So you can see nurses' brains are overloaded with empathy due to increased number of patients. Yes, of course, if only there is one patient, then you can easily understand or you can easily guess that this thing must not happen. They actually remain, in most of the cases or in most of the hospitals, they always remain overloaded due to increased number of patients per nurse. If you calculate that way, per nurse, how many patients are there in a hospital or in a nursing home or in any healthcare system. That way you can calculate. And their empathy is essential. You cannot ignore that thing. Okay. Anyway, I was talking about what? I was talking about their brain condition. Actually, studies show that due to chronic stress and compassion fatigue, there is a certain change in the brain regions. Brain regions means I want to talk about those amygdala, hippocampus, then prefrontal cortex. That actually, those brain regions are actually responsible for emotional regulation, then memory, then resilience. So these brain regions are affected due to their overloads, and this overload of nurses are popularly known as nurse burnouts. Nurse burnouts, this is not just a fatigue or exhaustion. This actually leaves a signature in the brain, and that's why so much problems are there. And since there are certain changes happening in their brain regions like amygdala, hippocampus and prefrontal cortex, that's why there is a chance of encephalopathy. I have already mentioned in the very beginning of this video that what is encephalopathy. That is nothing but a change in the structure or function of the brain regions in the brain. And regions are what? Now you know the regions. Okay. So you can see that their empathy, that is most essential, but their nurses' empathy becomes the stressor of the brain itself. That's why there is a paradox regarding this empathy, regarding the empathy of the nurses, which is known as what? Known as paradox of empathy. That paradox is known as paradox of empathy. This empathy, this is what? This is something which is most essential, but this most essential thing becomes, or better to say, this most essential thing, this empathy, can take a toll on the emotional health of the nurses. Okay. Anyway, so I actually, in a separate video, I'll discuss this stressor, empathy. And one more thing, there is a good news that interventions are possible, like practices of mindfulness, then peer support groups, workload management, recognition of the institutional burnouts of the brains of nurses. Institutional recognition, that is also required. Workload management is required, mindfulness is required. And you know, there are so much advances at present in the field of neuroscience. So by using those technologies already developed in the field of neuroscience, we can easily, means at an earliest, we are actually able to detect that brain signature, burnouts. To protect whom? To protect the nurses. To protect the nurses' brain. Better to say, to protect the nurses' brain. That means actually to protect the nurses. They are constantly protecting us. Nurses are constantly protecting us. Yes, you are right now healthy, you are enjoying your life. But patients, they are in hospitals and they are being cured by the help of the nurses. But due to their overloads, what is happening now? Right now you know this thing, because the topic of discussion was what? Encephalopathy of empathy. So actually, their brains always remain overloaded due to these things. So we should together work toward them, work for the betterment of the nurses, to protect their brain, to protect their lives, because they are protecting us. Anyway, so this was all about today's topic, and that last point, how to recover from this problem, or what are the possible solutions to this problem. For that thing, I'll make a separate video. Okay. Today's topic of discussion was just the problem. Due to excessive workload, what happens? Okay, with what? With the brains. Means what happens to the brains of the nurses. That was the topic of discussion. And only one point was there, encephalopathy. Anyway, so this was all about today's topic. This is the end of this video. If you found this video interesting, so please like, share and subscribe to our channel. This is the end. Thanks for watching.